Fractures starts on page 971 in your textbook. For this chapter, we're going to be doing the following objectives. Let me increase my screen there. Okay. Identifying types of fractures, signs and symptoms, and major complications. Comparing the types of medical treatment used for fractures, where we'll be getting into things like traction. Common therapeutic measures for fractures, which will match the pharmacology segment on analgesics. Nursing care of the patient with fractures will cover both those that have surgical repair and those that don't, and specific care for hip fractures, calls fractures, and pelvic fractures. If you look at the very first paragraph on page 971, it divides fractures into two main categories, complete and incomplete. And these are fairly simple to understand. Complete means there's a break through the full thickness of the bone, whereas incomplete means it's only partially broken. One type of incomplete fracture that you see pop up a lot on NCLEX questions and stuff like that is a green stick fracture, and that's commonly seen in children. And I don't know, you guys are mostly city kids, huh? But if you grew up places where you played outdoors a lot, green stick is a great description, because if you ever found a really thin stick and it was fresh, it had just broken off the tree, it's still green or soft inside, they're really hard to snap into, even if they're quite thin, because they tend to want to bend instead of break. Whereas if you find an old stick that's been on the ground for months and it's brittle, it's real easy to snap it into. So a green stick fracture describes a fracture in which one side is fractured or has a break in it, but it doesn't go full through, and the other side bends. So it's just like those fresh green twigs or sticks that you find that are so hard to snap completely into. Back to the complete fractures, we can further classify them as either open or closed. And maybe the more common terms are compound and simple. So compound is just another term for an open fracture, and simple is another term for closed fracture. The reason that the closed is termed simple is there's no break in the skin, so you're just dealing with the broken bone. Whereas with an open fracture or compound fracture, think of it as having compound problems. This is when the fracture causes the bone to break through the skin. So not only are you dealing with a broken bone, but you have a really high risk for infection, because you have impaired skin integrity and other problems associated with that. We can further grade fractures on a 1 to 3 scale. And again, this is straight from your book. 1 is the least severe injury, very minimal skin damage. 2 has moderate damage with skin and muscle contusions. And then 3 would be the most severe, the wounds larger than 6 to 8 centimeters with skin, muscle, blood vessel, nerve damage. Another classification of fractures can be stress, pathologic, or traumatic. And if you'll turn the page to 972, you can kind of see pictures of what I'm talking about. A stress fracture, in the picture it shows it on the bottom of the foot. And stress fractures usually happen from, think of it as a body part that's taking a beating. And I don't mean from assault and battery type beating, but like a jogger who jogs every morning and is pounding away on that foot like it shows in the picture. And just from overuse, it eventually develops a fracture. So that's what a stress fracture is, something from overuse. And a lot of times if someone has, let's say, some osteoporosis going on, so their bones are already weakened, it makes them more likely to have a stress fracture. Pathologic fractures are caused by an underlying medical condition. A lot of times, unfortunately, cancer might be the cause. And so if they have bone cancer and maybe they don't know, then sometimes the it's first diagnosed by, they get this fracture and they're like, oh, I didn't have any accident or injury. Why would I have a broken bone? And then it reveals an underlying problem like a tumor in the bone or something like that. And then you have traumatic fractures, which usually occur as a result of accident or injury. Fractures are most commonly caused by trauma, such as an automobile accident. In adults, the bones most commonly fractured are the ribs, according to your book, and the fractures of the femur are the most common in young and middle-aged adults, which that surprised me, but that's what your book says. And then hip, wrist, and vertebral fractures are most common in older adults. Here's a copy of that same chart that's in your book on 972. And I had to look up this one, an avulsion fracture. I didn't know what that was. But here's Mayo Clinic says, an avulsion fracture occurs when a small chunk of bone attached to a tendon or ligament gets pulled away from the main part of the bone. Hip, elbow, ankle are the most common locations, and looks like it's something that occurs in young athletes. It says usually you don't have to have surgical intervention. That sounds pretty nasty to me. So if you're like me and you didn't know what an avulsion fracture was, there you go. Comminuted means it's going to be broken in more than one place, and usually these are going to be open fractures. And so broken in 2 or more places, and the bone fragments are going to protrude through the skin. Displaced. Here's that green stick I was talking about. See that it's incomplete, so there's a fracture there, but it just kind of bends along this axis. Impact fractures are pretty painful, so you can see the treatment for this one is we're going to have to do some type of traction, pulling that bone out. Intra-articular just means joint. If you remember from our past lesson, osteoarthritis is degeneration of intra-articular cartilage, right? And so articular is in the joint. Longitudinal, here would be another incomplete fracture because it doesn't completely sever the bone anywhere. Oblique, pathologic, meaning there's a tumor right here that weakened the bone and allowed it to break. Spiral fractures, a lot of times a spiral fracture is suspicious, especially in elderly or children, because it occurs with a twisting motion. And so unfortunately a common cause of a spiral fracture is someone grabbing a child by the arm and yanking them away or something like that. Here's your stress fracture from overuse, and then just your basic transverse fracture. To help you study for the test, see if you can complete your workbook, page 290, from memory, and then check your answers from the book. But anytime you can do this from memory, if you get it right, you really know it. Here's a copy of the picture found on 973, which is talking about how a fracture heals, and it's important for testing purposes to know the time parameter. So on hematoma formation, this first part here, hematoma is where the blood cells are going to gather to start the healing process, and it's 48 to 72 hours. So remember, 48 to 72 hours on this one. Then it forms some granulation tissue, and then the next one I want you to really pay attention to the time parameters. Is callus formation, and your book says callus formation within 1 to 4 weeks of the injury. So if I said someone has a broken bone and they're on day 8, you should respond that this callus formation is where they would be in the process of bone healing. Then ossification. It's not really on this page, but within 3 to 6 months after the break, the permanent bone callus, known as woven bone, forms. And then consolidation and remodeling. And it doesn't really give a time parameter on that, but the ossification is 3 weeks to 6 months after the break. Now would be a good time to take a couple of minutes to complete the study guide on page 288, just to reinforce this. This is just a bullet point listing of all of the complications of fractures, and we're going to talk more in depth about each one of these one at a time, but just for a complete list, we're going to talk about infection, fat embolism, DVT, compartment syndrome, shock, joint stiffness and contractions, and impaired union. And you'll need to be able to differentiate like what signs and symptoms would suggest compartment syndrome versus what signs and symptoms would suggest infection. You'll need to be able to differentiate these from one another. So first we're going to talk about infection. Another name for infection of the bone is osteomyelitis. Some of the more common causes, open wound contamination. So we talked about open versus closed fractures. Open is where the bone is going to protrude through the skin. So those are always at greater risk for infection than the closed fractures. Indwelling hardware. Anytime that we do surgery and the surgery involves putting something non-human inside of a human, we're going to have a risk of infection that's increased. Or a lot of times our bodies know when we're putting something in there that doesn't belong, and we have this automatic kind of rejection of the hardware, and so that's going to increase the risk of infection too. Blood infections can occur anytime you have an infection in another part of the body, and when it gets in the blood it can travel pretty much anywhere. And then iatrogenic or healthcare associated infections, and those are infections that, like MRSA is probably the most familiar, methicillin resistant, and those are very costly, and Medicare is becoming more and more stringent on how much of those it will pay for, because Medicare's philosophy is if it's hospital acquired, the hospital should be punished for it. And if we punish the hospitals for it, then that will increase their motivation to quit making people sick. And so I can kind of see the reasoning behind that, although I don't know that it works, punishing the hospitals, because a lot of this, it just can't be helped. So I don't know. I have mixed emotions on that. I picked 4 main signs and symptoms for infection. This first one is probably, I'm not saying it's the least important, but local pain is going to make, if that's the only sign and symptom you have, that's going to make your guess not a very good one, because almost all of these disorders are going to cause local pain. So this is probably your least discriminating of signs and symptoms. Increased redness. Now we're getting into things associated with infection. A lot of the others that have to do with poor circulation are going to do the opposite and cause cyanosis or paleness, because they're not getting enough circulation. So this increased redness is one of those things that's going to be specific to infection. Purulent drainage. Purulent means pussy, and that's a sure sign of some infectious process going on, because what causes that are dead white blood cells. And so the white blood cells go to attack the bacteria or whatever the invading organism is, and they swallow it. And a lot of times they die in the process, and so those dead white blood cells, when they come out, it makes that white pus. And then fever and chills. Anytime you're doing a care plan on that has to do with infection, monitoring their core temperature, which just means taking someone's temperature oral or with those ear thermometers, or even the ones that go across the forehead, that will show their core temperature. But also where we're going to feel warmth is at the area where the injury occurred. And chills accompanying fever means it's in the process of going up. Treatment will be antibiotics. Anytime you have a bacterial infection, we can treat it with antibiotics. And osteomyelitis is not just a quick 5-day Z-Pack. Usually it's a little bit more involved. Might require IV antibiotics and for a month or more. So a lot of times we'll see people that develop osteomyelitis in places like where you're going Midwest City Select or Valor, or these places are called SNF, skilled nursing, so they need a little bit more care than just going home. Wound care and sometimes surgery to reopen the site. These wounds are not going to heal as long as they're infected, so we can get into some pretty gory wound care with these patients.